Today we will be discussing the 7th basic class on ECG, and that is the PR interval part 1. So here we will be only discussing what is a normal PR interval and something about the AV nodal block. Welcome to the class. Okay, so as everyone knows, what is a PR interval? It is the duration from the beginning of the P, that is from the beginning of the P to the beginning of the QRS. That is called a PR interval, and this PR interval represents the conduction from atria to the ventricle, that is, it represents the atrioventricular conduction, and the normal duration of the PR interval is 120 to 200 millisecond. Okay, we know that the maximum duration should be 200 millisecond. So we know that each small square is 40 millisecond. So that 200 by 4, 5 small squares. So we can say that the maximum duration of the AV PR interval is 200 millisecond, or it is up to 5 small squares. That means anything more than 5 small squares means there is a prolonged PR interval. Okay, so we should know something about the conductive system. This is the conductive system of the heart, and you can see that this represents the SA node, and this represents the AV node, and this is the AV conduction, and you can see this is the bundle of His. Then there is the right bundle to the right side, then there is the left bundle. The left bundle can be again divided into left anterior fascicle and left posterior fascicle, and if both the right and left bundle again divides into several branches called Purkinje fibers. Clear? So that the block can happen at any other site. Okay, if it is happening between the atria and the ventricle, that is between this area, we can call it as an AV nodal block. Okay, if it is happens in the right bundle, it is right bundle branch block. If it happens in the left bundle, it is left bundle branch block. So we will be discussing about all other blocks later only. Okay, so the AV nodal block can be divided into 3 types. There is a first degree AV nodal block, second degree, and a third degree AV nodal block. Okay, in the first degree AV nodal block, the only abnormality is that the PR interval will be prolonged. So come to the ECG. If you are counting the number of small boxes in this, from the beginning of the P to the beginning of the QRS, you can see there are 7 small boxes. That is, it is 7 into 40, that is 280 millisecond. That is, the PR interval here is prolonged, and there is no any other abnormality. Okay, so such type of an AV nodal block is called a first degree AV nodal block. Usually it does not cause much hemodynamic disturbances, but we have to be careful. It can be associated with various conditions like inferior myocardial infarction. So as such, the first degree AV nodal block won't cause any disturbances. So there are various causes of first degree AV nodal block. Okay, then coming to the second degree AV nodal block. Okay, in case of a second degree AV nodal block, the common thing is that there will be prolongation of PR with loss of a beat. In a second degree AV nodal block, there will be loss of a QRS complex in between. Okay, so based on the PR interval, we can divide the second degree AV nodal block into 2 types. There is a Mobitz type 1 and another one is Mobitz type 2. Clear? The Mobitz type 1 is also called a Wenke back AV nodal block. Okay, so in Mobitz type 1, what is happening that in Mobitz type 1, the PR interval will be progressively prolonged, while in Mobitz type 2, the PR interval will be constant. Okay, so it is very easy to remember. Assume this is Mobitz type 1, so this can prolong progressively. But in Mobitz type 2, so there are 2 lines in a 2, so it cannot prolong, it is constant, the length is constant. So it is an easy way to identify, it's very to remember, to avoid confusion between Mobitz, which is Mobitz type 1 and Mobitz type 2. Okay, so coming to this ECG, you can see that in the first, between the P and R, you can see there are nearly 5 small boxes. Then between there are nearly 7 small boxes. Then there are nearly 7.5 small boxes between the P and QRS. Then there is a P, but there is no QRS. Okay, the P is nearly 8 QRS, 8 small boxes. Then after this P, there is no QRS here. That is, there is a loss of a beat. That is, there is PR interval progressive prolongation with loss of a beat. That is called a Mobitz type 1 AV nodal block. Okay. Then as we have told in the Mobitz type 2, there is PR prolongation, but it is constant and there is a loss of a beat. Here the PR prolongation here, the PR interval here, the PR interval here are same, and here there is a loss of a beat after the P wave. The same PR interval, the same PR interval, and the loss of a beat is the and the PR interval is the same, but there is a loss of a beat. So that is called a Mobitz type 2 AV nodal block. Then coming to the third degree AV nodal block, which is also called a complete heart block. Complete heart block means there is complete absence of conduction between the atria and ventricle. That is, the atria is contracting and the ventricle is contracting independent of the impulses or the current from the atria. So there is no relation between the atrial depolarization and ventricular depolarization. We know that the atrial depolarization represents the P wave and the ventricular depolarization represents the QRS. Okay, so since there is no relation between the P and Q in the ECG, there won't be any relation between the P and QRS. Also, that there is something called a what are the classical criteria to meet a complete heart block. We can see that in a classical 4 criteria, the PP interval will be regular, the RR interval will be irregular, and the PP interval will be shorter than the RR interval, and the PR interval will be totally varying. So this was one ECG came to the emergency department. Here you can see that here this is a P, this is a P, and between the P you can see there are nearly 2.5 large boxes are there. So you can see this is another P, this is another P. Between those two can see nearly 2.5 boxes. That means they meet the regular PP interval. Okay. So then coming to the RR interval, you can see that this is one QRS, this is one QRS. Okay, then this is QRS. So between this QRS or the RR interval, there are nearly 1, 2, 3, 4, 5, 6, 7, 8 large boxes are there. Then you can see this is another QRS, this is another QRS. Between all those, you can see there are the equal number of, that is the 8 number of large boxes. That means the RR interval is same. That is, the RR interval represents 8 large boxes, while the PP interval represents 2.5 large boxes. That is, the PP interval less than the RR interval. And the fourth criteria, the PR interval will be totally varying. So this is also clear. This is a classical 4 criteria to satisfy a complete heart block. Okay, so this is a very simple topic. You have to go through the topic again. So thank you for your patient listening. The remaining part of the bundle branch block and PR interval will be discussed later. Thank you.